The Nuvant Mobile Cardiac Telemetry MCT system, developed by Corventis, is a technology designed to monitor your heart activity and help your physician diagnose any unusual rhythm of your heart. Once activated, the Nuvant MCT system will be able to detect and transmit medical data to the Corventis Monitoring Center. The data are reviewed by the Corventis Monitoring Center, and your physician is notified if an unusual heart rhythm is detected. The Nuvant MCT system is comprised of PICC, the adherent device, Z-Link, the data transmission device, and a patient trigger magnet to trigger an ECG when you feel symptoms. Inside the box, you will also find some literature explaining how the system works. Z-Link. Use the charger provided to charge the Z-Link. For certain geographies, a plug adapter may also be included. Insert the connector into the Z-Link. Plug the charger and adapter, if applicable, into an electrical outlet. Z-Link will begin charging immediately. If the lights on the Z-Link do not light up, push and hold the power button until the lights come on to turn on the Z-Link. During charging operations, the power light may flash between amber and blue, indicating that the battery charge is low. The Z-Link should be kept connected to the charger until the power light is blue. This may take up to 6 hours. PICC placement. Apply PICC to the left side of the chest, starting at the collarbone. Trim as much hair as possible from the intended location on the upper left chest. To trim the hair, it is recommended to use an electric razor or hair trimmer. Trim an area slightly larger than the PICCs. Avoid using moisturizers in and around the area prior to application. Using the prep wipe, prepare the skin area where PICCs will be placed and allow it to dry prior to PICCs application. Remove PICCs from the foil pouch by tearing at the notch. Take PICCs out of the pouch. Turn PICCs over to remove the covers from the underside. From the middle, lift and pull the cover without the tab first. Then peel back the second cover with the tab, removing it as well. For proper attachment, assure that there are no wrinkles and the edges do not fold in when applying. Bring the PICCs close to your upper left chest, holding it as shown. Take care not to fold the fabric onto itself while you handle the PICCs. Position the end with Corventis just below the collarbone and angle the device towards the nipple. To minimize skin irritation, do not place the PICCs over broken or damaged skin. For female patients, it is important to position the PICCs with the correct alignment, with the top half just below the collarbone and the lower half of the PICCs covering the upper area of the breast. A bra can be worn over the PICCs comfortably. Petite patients can angle the PICCs slightly away from the nipple and towards the left arm for a comfortable fit. Gently press the remaining edges until fully attached. Once applied, press the entire PICCs firmly against the skin to ensure contact. Immediately after applying PICCs, a light behind the filled circle will appear. This light will blink during use. Check the PICCs display for this symbol periodically, at least every 12 hours, to ensure that PICCs is functioning properly. Now you are ready to continue with your normal daily activities. PICCs is water resistant. You may shower with PICCs, but do not submerge PICCs in water by swimming or sitting in a hot tub. How to use the patient trigger magnet. Carry your patient magnet with you at all times. Whenever you have symptoms such as lightheadedness, palpitations, blurred vision, or other similar sensations, use your patient trigger to capture an ECG, a reading of your heart activity at that point in time. To capture an ECG, swipe the patient trigger magnet along the entire length of PICCs at a slow, uniform rate. This can be done by direct contact with the device or over light clothing. You may be contacted by Corventis to discuss symptoms when the patient trigger magnet is used. Z-Link should be within 30 feet, 9 meters of you at all times. At night, charge the Z-Link and keep it close to you while you sleep. The Z-Link should be kept on at all times to allow transmission of data from the PICS to the Z-Link. During the day, carry the Z-Link with you using the Z-Link holster. When the power light starts flashing blue and amber, it is necessary to recharge the Z-Link. Some patients ask about the other lights on the Z-Link. These are sometimes used by Corventis customer service, but otherwise can be ignored. When PICS reaches end of use, two lights behind a circle with crossed line symbols will appear, indicating it is necessary to remove your PICS. Depending on your prescription length, it may be necessary to replace PICS with a new one. PICS removal. Remove PICS by peeling back the edge of the device by gently pushing the skin away from the device as it is removed. Peel the PICS slowly. Rapid removal can cause skin irritation. Please do not use lotions, body oil, etc. if placement of a new PICS is necessary. Once it has been removed, do not reapply the PICS as this might affect monitoring. In addition, wait until the end of the monitoring period before disposing of the PICS devices. This helps to ensure that all of your data are transmitted. Apply a new PICS if your prescription has not yet been completed. Returning Z-Link. Once your prescription has ended, return Z-Link, the Z-Link charger, and the patient trigger magnet per the instruction provided. Thank you for using the Nuvant Mobile Cardiac Telemetry System.